Welcome back to the Nutrition Free Podcast. I'm your host, Michelle Yates, a registered dietitian, and this show is for discussing how to have a nourishing and healthy relationship with food while being free from all the diet misinformation, food guilt, and disordered eating. Our episode today is specifically designed to help you with navigating the nutrition misinformation today. There's so much with social media, and I mean, there really always has been with any form of media, but especially with social media at our fingertips. And my guest today could not be more perfect for this topic. Dr. Idrees Mughal, better known as Dr. Idz, is a medical doctor with his master's in nutritional research and is board certified in lifestyle medicine. Dr. Idz on Instagram and TikTok has a combined following of over 2 million due to his hilarious reaction videos where he breaks down the flaws in the health and wellness videos that we see today. And the nice thing about his videos is that he really shares the evidence and the science behind why this is misinformation, whatever it is that he's talking about or highlighting at the time. His myth-busting, quote-unquote, school videos have drawn quite a crowd, like I said, but with it are people hungry to learn more about how they can know for themselves if somebody's health and wellness advice is to be trusted or not. Maybe it's just total BS. It's tough to know, and so that's why I really like following Dr. Idz, because he does a really good job of breaking it down for the average person to understand. Today, I'm actually going to discuss 2 different topics with Dr. Idz, so we're going to have 2 episodes, and in today's episode, we're diving deep into how to figure out whether you should trust somebody's nutrition advice or not, and how to decide who to trust. And then in my next episode, we're going to discuss the topic of health at every size, which is a big part of the anti-diet movement. We want to discuss that in more detail and kind of have an open conversation about how evidence-based that is. Really quick before we dive into this episode, I do need to forewarn you, after recording that whole episode, I realized that my microphone was set to be on my AirPods. So as a result, I have this beautiful microphone next to me, by the way, but I just forgot to do the setting where it uses the mic for my sound. And so as a result, it sounds like I'm on the phone and I'm like calling into the show or something. So I just want to acknowledge that and apologize in advance for all of you listening who expect the highest quality sound out of a podcast. I'm the same way. I would expect the podcast I'm listening to, especially the host of the show, to have good sounding audio quality. And unfortunately, I totally screwed up. So I apologize in advance. But I had such a good conversation with Dr. Idz that I didn't want to scratch the whole episode, and I was for sure not going to ask him to come on all over again. That is a complete waste of his time. So I hope you'll enjoy this episode, even though I made a mistake with the audio setup. Dr. Idz, it's so nice to have you here today. I've been following you for what feels like ages, like I was sharing with you a minute ago. So it's been really, really cool to now connect with you personally and be a part of the school, and to have you on the show is a huge honor for sure.
Thank you very much for having me. Yeah, it's a pleasure. I'm excited to do this, and excited for your future collaborations in the school as well.
Yes. So I don't know if I've told you how I found you yet, but I actually found you from, I don't know if you remember this, but you did a video on the statistic that 95% of diets fail. And as you know, the anti-diet kind of health at every size group of dietitians throw that around a lot, that statistic in particular. And so when I found your video at first, I was like kind of ruffled. I was like getting defensive, like, but they do 95% fail. And then I actually listened to like what you had to say, and I looked into the research and everything, because I take the time to look at what you cited. And I was like, oh, you make some really good points. So your video actually left a huge impression on me in a really good way, because it taught me that I shouldn't just like blindly follow what the people in my same field are doing, and the people that are in my nation, whatever. So I mean, that was impressive that you left such a big impact, because that's hard to do when you're on social media. So that's just a small little window into, I know, the impact that you've had on a lot of other professionals too. And that was really valuable. So thank you for that, because that was a good shift in my career to kind of recenter on.
Thank you for being receptive, which is something that a lot of professionals aren't.
Yeah.
And I've had many back-to-backs and back and forths with supposedly credible professionals who don't think it's a good idea to look into opposing evidence on whatever your stance is, and they'll just hammer and perpetuate commonly perceived statistics like the 95% thing, right? Just kudos for you for being receptive and doing what any credible professional should do, and challenging your own bias, which is great. Fantastic.
Yeah, yeah. Well, I think your content does a really good job of like convicting people to do that, and
Mm,
I also really appreciate that your content is not focused on one group of people. Like you're not specifically going after people who don't have credentials or people who are doctors or people who are dietitians. Like you really do
mm,
create content around anybody that
mm.
is maybe not seeing the full story, and then you give that full story, which is cool. So, I mean, you do end up picking up professionals quite a bit. How does it usually go when they see your video publicly calling them out?
Yeah, it's a good question. I would say that the majority of these professionals, no matter what field they're in, they will probably ignore it or block me as a kind of first response.
Mm,
That's probably like 50 to 70% of them. Another 20%
mm,
might kind of respond with a comment or to say, oh, well, you're simply wrong, or, just not bother to even listen to what it is that I'm saying. So it's like, what was the whole point of me actually making the video? But now what I've realized is actually me responding to other professionals and, providing some more of the nuance or, some kind of stronger evidences, it's not about changing that individual's opinion. It's about
mhm,
reaching the audience that individual has to then try and make them
mhm.
see more of the picture, right? So
Yeah.
now I really don't care if a so-called professional updates their view, because often, they've been so ingrained in, advocating for this particular narrative or this particular viewpoint that they have no interest in changing, even if all of the evidence in the world was to point the other direction, right? So I think it's more about
Mm,
kind of providing insight into their own audience, not so much the original poster or the original person that made the
sure.
content, right? So yeah, I don't
Yeah.
really focus on how they respond. I'm going to call them out, and I'm going to do it in a relatively respectful way, unless they're an outright charlatan, outright
Yeah.
grifter who. So yeah, like I have my method of doing things. I do also agree with
Mhm.
certain points as well. So I make a lot of videos where
Yeah.
I'm actually agreeing with the creator that a lot of people don't seem to remember because
Yeah,
they
you
love the
do.
drama,
Yeah.
right? People love drama. So
They do.
me agreeing with a statement's not gonna be in the back of someone's mind as much as me calling someone out and being like, you're a muppet,
Hmm.
right? Whatever, like.
Yeah. Yeah, and I'm sure that's what people usually respond to when you're calling them out, right? Is more
Mm,
like, "Oh, well, you disagree with me," and I whatever, but you're like, "Actually, I did agree with you on some points too," and they just miss
yes,
that, right? Because they feel defensive. Yeah.
exactly.
Yeah.
Yeah.
So I want to discuss that topic then of
Mm,
who to really trust then for nutrition advice because it can get so confusing, right? Like a lot of these people that you do videos about are supposed to be credible sources. And so it can get really, really confusing trying to figure out how do I know what's credible or not? Because this person has all the credentials that, and some obviously don't, like we've mentioned with the charlatans and everything, but like
mm.
some people don't, but some do. And you would expect what they're saying right off the bat to be accurate just from their education, but a lot of times it's not, right? So what are some of the things that you look for when a professional, regardless of their credentials, is giving whatever information out to figure out if it's credible or not?
Yeah, interesting question. I would say that one of the biggest kind of telltales for me when I'm, quickly browsing someone's content is, do they provide a balanced or nuanced discussion around anything, right? Are they the type of
Hmm.
person to make reductionist, kind of like absolutist statements? Or are they the kind of person that actually provides nuance and, provides a balanced argument, right? Because as we know in health science,
Yeah,
nutrition science, there is no absolutes. There's no like one solution for all people. There's no one best
right.
intervention for all people. And how do you even quantify, the best for something, right? Because you need to obviously look at different demographics, different kind of medical populations, different ages, gender, etc. So I think when someone makes content and straight away I see statements like, you know, here's like the worst 3 things you can do for your health, right? And it's some random, you know, drinking tap water or flipping, you know, brushing your teeth with fluoride, something like just random, just
Yeah.
nonsense, right?
Yeah.
Straight away, those kind of segments are, I'm just like, I don't even have to look at anything else they're saying. I just know automatically they're not credible, right? Because no
Right.
actual academic, you know, find me a single scientific publication that goes, here are the 3 worst or best things you can do, right? That's just no academic talks like that,
Yeah.
because we understand that, you know, you're supposed to understand that there is obviously exceptions to every rule, and
Sure.
people that
Absolutely.
are just, they're making kind of like sensationalized, you know, styles of content to incite emotional responses, incite kind of controversy. Those aren't the kind of people that I'm interested in, and I wouldn't advise my followers or your followers to, you know, take those creators with any kind of authority or as a credible source of information. That's probably one of the biggest
Hmm.
giveaways. Another giveaway is creators that don't even allude to evidence or allude to science, right? That's obviously a major giveaway,
Yeah.
people making claims without any kind of scientific backing. And then those who do make claims, right, when they're a bit defensive about it and they're a little bit hesitant to provide evidence, they become a little bit sassy, you know, like
Mm.
someone off the top of my head that springs to mind straight away is like, you know, Max Lava Lamp or whatever his last name is, Lugavere. He'll you know, he'll become very sassy like a child, you know, he'll just insult people. And I've seen it
Mm.
time and time again, you know, people that think that people should just take their opinions as gold standard without, you know, any kind of
Yeah.
questioning is seen as being, you can't question what I'm saying, right? It's
Yeah.
like
Yeah.
how are you supposed to frame yourself as an expert if you're not gonna,
Yeah.
you know, if you're not gonna welcome criticism or, you know, constructive criticism? Obviously, I'm not talking about insults. I'm talking about genuine
Right.
questions or, you know, elaborations. Someone that is actively defensive, actively snarky, actively not willing to expand on the content. That's another big giveaway that they're not credible.
Yeah.
And another one, I think this one will filter like 90 to 95% of nonsense creators, right? If someone
Mm.
demonizes seed oils or omega-6 fats, you can
Immediate
just
no.
ignore the rest of their content. That is such an easy filtering system. If Instagram or Facebook or TikTok had,
Yes.
you know, a seed oil button, tick or a cross on everyone's page, you can just figure out straight away, no serious academic,
Yes.
no serious expert,
Yeah.
no serious researcher would ever demonize seed oils, because the overwhelming amount of human evidence, right, shows they are not inflammatory and in a lot of cases anti-inflammatory, right? They don't cause
Hmm.
cardiovascular
Hmm.
disease. When you replace saturated fat with polyunsaturated fat from seed oils, you lower, you know, myocardial infarction rates, you lower cardiovascular disease risk,
Yep.
you lower all-cause mortality, and not even an observational study. I'm talking randomized controlled trials, right? So
Hmm. Hmm.
that's, I think those 3 principles, you know, someone that lacks nuance, lacks balance in the conversation, and uses absolutist or sensationalized styles of intros, a big red flag. You know, someone that's snarky, you know,
Yeah.
defensive, kind of hesitates to provide evidence or elaborate on their evidence, another red flag. And demonization of seed oils. Those 3 things, you'll probably filter out 95 to 97% of nonsense information, probably.
Yeah. I love that idea of just having a filter on Instagram or TikTok or whatever, where it's like, does this person have this narrative about seed oils? Yes or no? Yes. All right, moving on.
Yeah,
There you go. There's your instant filter.
yeah,
So
it's true.
when it comes to, I think that people a lot of times come to me and they're like, oh, my doctor told me to do this, my doctor told me to do that, and, you know, in terms of nutrition. And a lot of times what I'm hearing is things that aren't supported by evidence, at least in the US. So I feel like doctors in the US a lot of times kind of miss the mark when it comes to nutrition. So I'm curious if you feel like you're obviously a doctor. So do you feel like doctors in general are a credible source for nutrition information?
So this is a difficult one because it really depends on the structure of the curriculum that you are obviously formally educated in. You know, I can only speak
Sure.
for my
Yeah.
experience in some of the universities kind of around the UK that I'm very familiar with because I've done, you know, medical school interviews. I've done, you know, for hundreds of students. I've obviously lectured at different universities. So what I would say is, for my university, University of East Anglia, you know, they're a very progressive, very kind of modern style of medical school where, you know, from the first week of the first year, you're thrown into hospitals, you're thrown into GP practices, you're thrown into primary care, you know, you're doing live dissection on actual human bodies, right? You're doing problem-based learning in groups, you're also doing lectures, seminars. So our entire first semester, the whole semester was called a holistic understanding of medicine, right? So imagine you
Okay.
come into university and you're expected to like, oh, go straight into, you know, medication and radiology and CT scans and x-rays and how do we treat XYZ.
Sure. Yeah.
And your whole first 4 months is spent around a topic called the fundamentals of the holistic nature to medicine, right? And that whole first
Yeah. I
semester
love
was
that.
all about, it was all about, you know, how to improve, you know, health outcomes, the importance of exercise, you know, the metabolization of different nutrients and what, you know, what constitutes a healthy dietary pattern. And you've got things like, you know, what are some myths around how people catch viruses or illness, you know, like these kind of old fairy tale, not fairy tales, old, what are they called? Wives' tales, right? Where you would
Wives'
step
tales.
outside
Yeah.
it.
Yeah.
Yeah, you would step outside in the cold and, oh, don't go out in the cold with wet hair because you'll catch a cold, right? And it's like
Yeah.
we did a lot of this kind of debunking of kind of old, you know, misconceptions surrounding health in the more holistic sense of the word, right? So that's how my university did things, and I think any, you know, medical school around the UK at least, you know, they provide a foundational knowledge on, you know, the importance of different nutrients, you know, what happens to fats when you digest it, you know, how does insulin resistance start, obviously because that's a medical condition, you know, fatty liver, you know, what are the, you know, how do you improve certain outcomes to do with brain health, etc. I think UK medical schools in general, they're taught about the principles of the UK dietary guidelines, which are very evidence-based, of course, as are the American ones. Many people won't like to hear
Sure.
that, but I'm sorry to tell you
No, I
that
know.
the dietary guidelines are pretty, like, they're very robust, and there's a reason why they're robust because the evidence says so, right?
Yeah. There are so many people against them, though.
So yeah, we can. That'll need a whole nother podcast.
That's
But
another episode.
basically,
Yeah. Yeah. Yeah.
But you know, I guess what I'm trying to say is because nutrition is a very tiny component of all of medicine, because medicine is so vast, it's so huge, there's so many avenues to someone's health, right? How much emphasis someone wants to put into their nutritional understanding is going to be very individual based, right? So if you're a doctor in medical school
Yeah.
and you're very you know, you find a passion, or you find that you're very passionate about the nutrition aspect of medicine, then sure, like, you know, as with I did, you know, I took time to do additional studies. I looked more into the research.
Yep.
You know, I used my skills from research methods that medical school is very heavy on, you know, how to actually critique peer-reviewed evidence. I think we spent 4 years doing that without even my extra master's degree. So you can gain what you want from how much you want, right? If you want to minimize the emphasis on it, then you don't have to cover it at all, really. You know, just go to the lectures, ignore that part of the textbooks, like ignore that part of placements, right? Like you can just stay at home if, you know, when you're doing a shadowing of a hospital dietitian, for example. Like you can take as much as you want from it. The real important thing to remember is that all doctors in the UK, they are taught a predominantly evidence-based style of healthy eating. Whether that gets construed later in life or from their own biases or from their own patient stories, they might see one day that a patient with fatty liver disease and obesity massively improved their health because they went on the keto diet, right? So
I knew you were gonna say that.
right,
The
right,
keto
it's
diet
true.
specific.
Yeah, it's true. So like,
Yeah.
over time, and you can imagine over months and years, those doctors who have seen anecdotal evidence for different things, they will then be more inclined to look into perhaps that specific avenue for nutrition. And then
Yeah.
before you know it, they get lost in the whole sphere of, low carb, animal based, weight loss is the
Yeah.
end all be all, for example. And
Mm.
they lose the fundamental teachings of what was taught in medical school, right? So I
Right.
think that's where a big problem arises, is their own individual experiences with them and their patients, and they take that
Yeah.
as being evidence, right? And I think
Yeah.
as
Yeah.
long as all of us as medical professionals just think back and we actually, think back as to what is strong scientific evidence and what's not, I think we can do a better job. Now, that being said, there's another issue to answer surrounding this topic, is that the way the UK healthcare system is set up, it's very difficult for any doctor to actually provide any kind of targeted, tailored nutritional advice, right? That's because when you go to your primary care doctor, you literally have no more than 8, 10, maybe 11 minutes if you're lucky, yeah, to find out what the
Yeah, that's how
problem
it is in
is,
the US.
to review their medical history, to assess them, to physically examine them, right, depending on what the problem is, to hear their thoughts, hear their concerns, make a plan, document, refer, prescribe, right, send them for a scan, right, and then you gotta
Yeah.
send them out in a nice kind of way. Then you gotta bring the next person in. Even me, who I would say that I'm pretty informed on, nutrition science, if you gave me that time, I wouldn't be able to offer any beneficial advice, right? All I'd be able to
Yeah.
say is, look, follow the dietary guidelines. That's all I have time for, right? Right now.
Yeah.
If you want
Yeah.
a tailored intervention, then I'm going to need at the very least 30 minutes. All of my private consultations are 60 minutes, right? And even then, sometimes I
Right.
need more time, right? So like, I just think it's a very difficult ask to say, doctors, you need to be providing better nutrition education. And it's like, even if you have the knowledge and even if you are evidence-based, the infrastructure is not set up in a way that allows
Yeah.
you to actually give tailored, targeted advice, right? So that's where, obviously, we need a system where there's an easy referral system to dietitians. There needs to be ease of access to everyone. There needs to be allocated clinics in primary care where doctors can actually give lifestyle intervention in a more comprehensive manner, where they could talk about exercise, they could talk about stress, they could talk about, the harmful effects of staying isolated and not socializing, right? They could talk about the benefits of following a healthy dietary pattern. The system is not set up like that at the moment, and I hope to see it change
Yeah.
in the future.
I think you bring up a really amazing points, and that's very similar to how it is in the US as well, where providers, physicians really only get 5 to 10 minutes with their patients because they're constantly going, they're seeing like 5 people an hour, and so it's that's kind of in where the issue comes, where patients don't feel listened to, they don't feel heard, they feel like they got bad advice, and so then they turn to these like functional providers who take hours with these people and maybe give them not so great advice. So actually, I'd love to hear just a quick, like, your thoughts on that kind of functional space, because I do feel like there's a little bit of, I mean, that's really the bridge there, is that these patients feel like they're not being listened to and heard because of the system, not because of that doctor in and of itself, but because of the system. And so, yeah, I'd love to hear your thoughts on kind of like the functional space and on, I don't know, what do they call it? Complementary medicine?
Yeah.
Yeah, what are the red flags that you see there?
So, a couple things. I would say that just the term functional for me is just a bit of a red flag. Like, I wouldn't automatically, disregard everything a functional doctor or functional naturopath or functional dietitian is saying, but to
Yeah.
me, it preys on the vulnerability of certain people who don't feel listened to, as you rightly said, because of the time constraints, because of
Yeah.
the pressures, the work pressures. And I feel like this space has just they've catapulted, and they've leveraged off of the way that, the limitations of Western medicine at the moment, right? And they've they made a kind of false promise that,
Mm-hmm.
if you were to follow my advice, I'll give you everything you need, right? I'll tell you all of the correct supplements. I'll tell you what the root cause of your disease is, which is absolute garbage. No, you don't know what the root cause of disease is, because for any disease, there's multiple root causes, right? So it's a very stupid thing to say. And in a weird way, I don't know why they all think that, lifestyle changes are the root cause of every disease. It's just so absurdly
Right. Yeah.
it's just so absurdly reductionist. It's like they try and paint you a picture that you have complete control over your health, and if you fall ill, it's like it's completely your fault and you should have listened to me earlier. And it's like,
Right.
what on earth are you
Didn't take
talking
enough
about?
elderberry syrup.
Right? And it's like, well, if you just took my concoction of super greens and 26 supplements in the morning, right, you wouldn't be where you are now.
Yeah.
And it's just like, oh, for God's sake.
Yeah.
I think this whole phrasing around functional medicine, I'm not a fan. Obviously, like, I refer to myself as a lifestyle medicine specialist because that's what the board
Mm.
certification is. We don't use terms
Mm.
like functional because we understand that. I don't actually know what functional means. Like, what does functional mean? I'm not actually sure.
Yeah, I know. I couldn't tell you, but it's very like I almost feel like it's kind of an oxymoron a bit, like especially with functional diet. And this isn't to call out any specific dietitians, because again, like we're not
Do
automatically
it.
discounting that.
Do it. Call them
But
out.
but when I see like holistic dietitian, it just kind of irks me because I'm sitting there like we went into a field about nutrition. It's holistic in and of itself. You don't need to clarify that again, And
Hmm.
it's
Hmm.
a little bit, it is a red flag because it's like, why do you need to restate that? What are you trying to prove, I guess?
It's a great point that actually Western medicine is also holistic in nature, right? Like if you
Yeah,
look at,
right.
the National Institute of Clinical Excellence, which is the main guidelines for how we treat certain diseases here in the UK. If you look at all of the first line interventions for loads of conditions, right? Whether it's depression, type 2
Mm,
diabetes, fatty liver, insulin resistance, polycystic ovarian syndrome, obesity, cardiovascular disease, hypertension, name whatever you want to name, right? If you actually looked
mm,
at the clinical excellent guidelines, a lot of the first line interventions are around psychological help, right? Exercise
yeah,
interventions, right? Healthy eating interventions, stress management, right? Reducing alcohol, smoking, use, right? And you've got things like,
yeah,
increasing activities in the community, and working on stress, things, and CBT, and ways to help with mental health issues, right?
yeah.
Nowhere is anyone encouraging doctors to jump straight to like medication,
A prescription. Yeah,
unless if it's a life-threatening issue that needs to be addressed right
yeah,
now and then. Of course, like you need to save their life, right?
yeah,
But I don't get this whole idea that Western medicine is all about pills, when actually, no, it's not. The problem
yeah,
is that often when people actually come to the doctor, they've already exceeded that low to moderate intensity illness phase, right? They're coming at a
yeah.
severe stage of illness, a severe stage of high blood pressure, a severe stage of
Mm,
elevated blood lipids, right? So in those cases, you
mm,
need to get things down early and early quickly, to better obviously
mm,
help their health. So I think this whole thing about why do you need to clarify that you're functional in nature when all of medicine should be functional? It should be, it should be holistic in nature.
yeah,
I don't understand. Like I don't understand this whole narrative that, big pharma is like the end all be all for, for medicine, and that's just
yeah.
simply not the it's just not the case.
Yeah, yeah, exactly. And I think it brings up a little bit of hypocrisy too, because then we're in the functional, again, I'm generalizing here, and I know there's
Yeah.
exceptions, but in the functional space, there can be this just blatant denial of everything that has come before for that patient with their doctors and prescriptions and any advice they've gotten. And so then it's almost like, I mean, it's that reductionistic attitude that you were talking about earlier, where we're saying that none of that matters. What matters is the root, quote unquote, root causes, and doing all of these tests that might not even be evidence based or accurate. And then it's like, how is that functional? Because then you're ignoring so much that came before, which should be a
Mm.
part of the whole clinical picture. So it feels like a little hypocritical. But I don't know. That's been on my mind a lot. I feel like there's a lot of targeting going on with that. It's a
Yes,
shame.
it's a great point. It's a great point. And I think these people, when they make egregious claims, I think they do need to be called out and held accountable because,
Yeah.
you're selling a dream. You're selling a dream and making,
Mm,
sensationalized claims surrounding what holistic or functional healthcare can do for you, when all healthcare should be that anyway. I don't know why you feel the need
yeah.
to, try and isolate yourself in a tiny little box so you can prey on a certain demographic, right? Yeah.
Yeah.
Anyway,
Yeah. Yeah. Well, I love this was super helpful. So I feel like to kind of sum things up for our listeners here, when they're trying to figure out, okay, who should I trust online? Who's a credible source of information here? Number one, does that individual have some balanced and nuanced conversations around their whatever it is they're talking about? And maybe not in the context of the doctor's office because they only have about 8 to 10 minutes with you. So you're probably not going to have those conversations there, but hopefully you do. We don't know. They just probably don't have time for it. So that's not a great time to judge that. But otherwise, look for that balanced conversation, look for those nuances. And then, yeah,
you know, it's your
yeah,
job to answer complicated questions. So if you don't want to answer them, don't be online in the
mm,
first place. Why are you online making content,
mhm.
right? Just go away.
Yeah, I love it. I love it. And I think that applies to being in person too, right? When these people
Yep.
do meet with a functional provider, a chiropractor, or their doctor, right? Like they need to be able to engage in those conversations. Otherwise, it's a red flag. So, yeah, really good points. I love that. I think that's super helpful to our audience. And yeah, in terms of, trusting providers for advice, I think it kind of goes back to those same things, right? No matter the credentials, no matter the education level, are they willing to have balanced and nuanced conversations or not? So I love that. That's super helpful. I do want to just kind of like put a note in here to promote your school. You have your online school of Dr. Idz, which is a fantastic resource for anybody who is wanting to dig deeper into these conversations and nuances of health because it's not simple. You can't really have a meaningful conversation in a 30-second TikTok or whatever it is.
Mm, mm.
So I really love your school, Dr. Idz. I feel like it's great for having those in-depth conversations where you dig into the research and everything. So I mean, anything you want to say about the school?
Yeah, no, that's a great summary, really. It's meant for people that kind of they already understand the basics and they want kind of more nuanced, balanced, kind of higher level scientific research where they're actually interested in how to critique the evidence base and how to apply it to their own client base or patient base, or if they're just a health enthusiast and they want to be more informed about certain topics. That's definitely what the school is tailored for. Imagine my TikToks, but 5 times longer and higher level
Mhm.
and cover a bit more kind of nuance surrounding certain topics that aren't really appropriate for social media. There are some topics that just aren't
Mhm.
really they're not designed to appeal to kind of like the mass audience really. So yeah, I
Yeah.
would say just, and obviously I try to respond as best as I can to all kind of questions, and people ask me very complicated questions that everyone can have access to as well. So yeah, yeah,
Yeah. It's a great resource and it's super affordable for anybody who's just interested in the topic, interested in the field. I think
Thank you.
it's great for everybody. So, and you might even recognize one of the teachers in the school.
Yes, yes. Another video coming this month. Yeah.
That's right. That's right. Get excited.
Amazing.